I'm Dr. Sonja Fuqua, and I'd like to welcome you to our 7th in a series of 8 65 by 65 First Friday webinars. We collectively call them Combating Pandemic Pounds and Corona Carbs. And today we have stress and obesity. The presentation will be done by Dr. Josie Bidwell, an associate professor at the Department of Preventive Medicine at UMMC, and so much more. I wish I had time to share her entire bio, but I don't. So Dr. Bidwell, thank you so much for joining us today. Feel free to share your slides, and I pass the mic to you.
Great, thank you so much. Let me get these slides pulled up, and I'm glad you did not share the whole bio. It always makes me so uncomfortable listening to somebody talk about myself for a while. All right, I hope you guys can see these, see the slides, and we'll go through these. And I'm really, really thankful for the opportunity to talk about stress as it relates to obesity today. I often get asked to talk about nutrition and exercise, and I absolutely adore talking about those. They are very, very important. But stress and sleep are kind of the two threads that run underneath a lot of our behavior choices when it comes to what we eat and whether we exercise. So when I work with patients on lifestyle modifications, stress and sleep are often what we focus on first before we move into making a lot of nutritional changes or a lot of exercise changes, but they're all really, really needed. And so I mentioned when I work with patients and what I do on a daily basis here at UMC is to run the lifestyle medicine clinic, as well as some of our other preventive medicine service lines here. But my great love and passion is lifestyle medicine. And it's often a word or a branch of medicine that people aren't super familiar with. And so it is its own separate medical specialty that is practiced by healthcare providers from lots of different backgrounds, lots of different disciplines. So there are nurses and nurse practitioners, there are physicians, there are physical therapists and pharmacists and dietitians, and just a whole host of medical professionals that practice lifestyle medicine. It is a board specialty as well. And so we have the only kind of dedicated lifestyle medicine clinic in the state. And myself and the other nurse practitioner that staff lifestyle medicine clinic are board certified in lifestyle medicine. And what it is really a combination of multiple lifestyle factors and really getting to the root cause of disease, not just symptomatic management or symptomatic treatment of disease, but the actual root cause. And when we look at obesity, weight management is a very, very complex issue. It cannot just be managed with diet and exercise alone. You may have some initial success with that, but sustainability often depends on making sure that we look at these other pillars of lifestyle and how they affect cardiometabolic health. And so the 6 pillars of lifestyle medicine are nutrition, sleep, exercise, substance use, stress management, and healthy relationships and resiliency. And today we're going to focus in on that stress management piece and talk about how it affects our health behaviors and how that in turn affects our weight management strategies. So it is a cycle. It's often hard to kind of know what came first, but we call it the stress obesity cycle, because when you have chronic stress, it often leads to health behaviors that lead to obesity. And obesity often leads to weight stigma. And just the act of being overweight or being obese and having that stigma attached to you is in and of itself a stressful life event, which just perpetuates that cycle. So we have to find a way to interrupt the cycle of stress, unhealthy behaviors, weight gain, stigma leading to more stress. when we look at stress in America, it has changed a little bit in the past couple of years, actually in the past year, after being relatively steady for a while. So the American Psychological Society does an annual survey and publishes that information. So I looked at the 2019 survey, and it looked at what Americans consider a healthy stress level, right? And we'll talk a little bit about good versus bad stress in a minute. But Americans believe that healthy stress level was on average a 3.8 on a scale of 1 to 10. So 1 being very little stress, 10 being very, very stressful, or a great deal of stress. The average stress level that people reported in 2019 during the past month was 4.9. Okay, so above what they kind of identify as being a healthy level of stress, so indicating that people do perceive stress as a problem in their life. But that 4.9 was relatively unchanged from previous years. I think it was 4.8 the year before, somewhere along in there. And common stressors were things like money and work and healthcare, the election, mass shootings, those types of things. When this study was repeated in 2020, if we look at just adults overall, the average stress rating went up a little bit. It was 5, which is not grossly elevated above the 4.9 from the previous year. But when they parceled that out by actual generational groups, the Gen Z adults were continuously creeping up. So 5.6 to 5.8, now to 6.1, which is over that tipping point of moving from manageable stress into stress that is going to start to affect daily living. And of all adults, 19% reported that their mental health was worse this year than at the same time in the preceding year. And those stressors that were identified were more likely pandemic related, as well as planning for their future and the economic response to the pandemic. And I put links to both of those surveys there if you're interested. There's lots of good information in those slides. All right, so good versus bad stress. So in general, I try to stay away from terms like good and bad. But when we're talking about stress, there is stress that serves a purpose, and then stress that starts to harm us. So some of the other terms that we may see are adaptive stress versus maladaptive stress, or acute stress versus chronic. And to really think about that, we think back to, stress from an evolutionary standpoint of running away from a bear, running away from a tiger. That acute stress and that acute release of stress hormones was necessary and protective to us to make us run faster, run farther, with an increased burst of energy. Unfortunately, fortunately, we're not running from bears and tigers much anymore, but from an everyday life, we've moved into that kind of acute stress into more of a chronic stress. And there's still, even in chronic stresses, stress that is productive, right? So I've got this little bell curve going on here where we can see the kind of yellowish area is the sweet spot, so to speak, with stress, where it is keeping us focused and motivated with just a healthy amount of tension, right? Maybe that's having a due date for a project, right? That keeps us focused and motivated and allows us to care about the product that we're producing or whatever we're doing. It does reach a peak though, and if stress continues past that peak was where we start to see fatigue and exhaustion. In healthcare, we start to see burnout and breakdown from that kind of prolonged, continued elevated levels of stress. So how does stress and obesity impact each other? There is a great review in the annual review of psychology that looks at the different pathways for stress and obesity. And they identify a couple, a cognitive process, behavioral process, and then some that they're terming physiological and biochemical And those get into things like neuropeptide Y and some different biochemical processes that I think is probably a little outside the scope of what we're trying to achieve today. So I kind of limited our talk to how cognitive changes and behavioral changes link stress and obesity. And we'll talk about a few hormones as well. But when we talk about cognition, we're really talking about self-regulation. And then when we talk about behavior, kind of linking stress and obesity, it goes into our food choices, our physical activity, and our sleep. So self-regulation is controlling behavior, right? It's one's own ability to control their behavior. It often gets termed willpower, which I do not like because it implies that if for some reason you choose a particular food that's not so healthy for you, that you somehow are a weaker individual or have a lack of willpower. And that's not the case. There are hormonal and chemical changes that are taking place that are affecting our ability to self-regulate. But it is an important strategy for weight management, right? That stress impairs our ability to perform self-regulation as well, or what I like to call make good decisions, right? Everyone from a knowledge standpoint, or most people from a knowledge standpoint, know that a cookie and an apple are different in terms of their nutritional makeup, and which one is going to push you closer to achieving a healthy weight, and one that's going to push you closer to maybe having an issue with too many calories on board, those kinds of things. But the decision on whether to eat the apple or eat the cookie is a complex one, right? And so when we have issues with being able to kind of self-regulate that impulse, that cookie sounds much, much better for making us feel better right this second. And so we have to work on being able to kind of take back some control of that will increase our ability to make those good decisions that match our health goals. Food choices. So when I say the word comfort food, that just boils it all down into two words, right? That we use food for comfort, right? So that when we're stressed or we're sick or we're anxious or we just don't feel good, we want comfort food. And what does that mean? Well, I just Googled comfort food, and this popped up, macaroni and cheese, which I know is one of my favorite items when I don't feel well. But we have to think about how that plays into our overall coping strategy in our day-to-day life, right? Are we using comfort food every single day? If so, one, we've probably got increased stress levels, and we need to work on tackling the stress so that we don't feel like we need comforting from food every day. Right? Stress increases the desire to choose highly palatable foods. And what that means are, of course, foods that taste real good, right? And that's usually things that are high in fat, high in sugar, or high in the combinations of the two. So when we get stressed, it's not that we usually think, man, I really want some grapes. It's, man, I really want some chips, or I want a piece of cake, or that cookie, or ice cream, or something like that. It drives that stress drives that response to want one of these high caloric density foods. And it could manifest itself in just eating larger volumes of food, eating more unhealthy food choices, or a combination of the two. But the take home is that stress, when it's maladaptive and we don't have other good coping strategies, often leads itself to choosing very high calorie density foods as a coping mechanism. Increased stress levels also lead to decreased physical activity, okay? And so this can turn into a cycle. And I'm sure y'all talked about it when you talked about your physical activity module, that physical activity is a good stress reliever, right? So we can use exercise as a way to improve mental health, but increased stress levels can also lead to less desire to be physically active. So it can definitely get into a cycle of, I don't feel like exercising, so I don't exercise. And my stress increases. So again, I don't feel like exercising, so I don't exercise. So we have to find a way to break that cycle. And how we do that looks very different in each person, because people are not the same. We're not carbon copies of each other. And we have to match interventions and behavior changes to where each individual person is in life. Sleep. So stress absolutely can negatively impact sleep quality and duration, or quantity, right? So either not sleeping long enough, or the sleep that we do get is not restful, it's interrupted. And when we look at how sleep impacts obesity or weight management, shorter sleep durations, right? And the normal sleep duration is 7 to 9 hours. Okay? Shorter sleep duration is linked to higher BMIs. So people that sleep a shorter amount of time tend to have a higher weight. Okay? And there are several theories and pathways that contribute to this. One is it decreases thermogenesis. So it decreases your energy expenditure. So it lowers your metabolic rate, right? So you just don't burn as many calories being alive as you would if you were getting adequate sleep. When you don't sleep well or sleep a short duration of time, you're fatigued. We often underappreciate the level of fatigue that we have because we're so used to being sleep deprived. But that fatigue does make us feel less likely to be physically active. If you sleep and you wake up and you feel like you haven't rested at all, it's very unlikely that you're going to then go, well, you know what, I should go for a run, or I should go to the gym, those kinds of things. And then there are a couple of hormones, and we're going to talk about ghrelin and leptin. And so these are two of the hunger hormones. Okay? Leptin is the hormone that makes us feel full and satisfied. It's the satiety hormone. And ghrelin is the one that makes us feel kind of unsatisfied or hungry. And so poor sleep, either from a short sleep duration or poor quality, actually causes leptin to go down and ghrelin to go up. So it makes us hungry. And again, it's not a hunger for necessarily fruits and veggies. It's a hunger for those highly palatable, sweet, salty, fatty types of foods to boost our energy level quickly. Cortisol is not on here, but that also plays a role. Shorter sleep duration, we usually have some higher cortisol levels going on. And cortisol, while it is the stress hormone, also can lead to fat accumulation, and particularly around the midsection or around the abdomen, which I know a lot of the women that I work with always come and say, how do I get rid of this belly fat? And so looking at stress and sleep is one of the really important things to do there. So now that we know kind of how stress impacts obesity, right, then we think back to how do we fix it, right? You know, how do we work on these things? And kind of I have kind of 5 steps for that. Step 1 is making sure we get the correct diagnosis on these things. Step 2 is interrupting the cycle. Step 3 is setting a goal. Step 4 is developing an action plan. And then step 5 is practicing those healthy habits. So what do I mean by a correct diagnosis, right? Well, there is stress, right? And there is that kind of adaptive stress that we talked about, then moving into that maladaptive stress. And then there are kind of a potentiation of that into more of a clinical depression or an anxiety. And we want to make sure that we're getting the appropriate help needed if we have an anxiety disorder, depression, and get the appropriate treatment for that. And unfortunately, just like the stigma that exists with weight, there's a stigma with mental health as well. But we've got to break the cycle. So we've got to ask for help, not being afraid to ask for help. So this is the PHQ-4, which is 2 questions about anxiety and 2 questions about depression. And this is the screening tool that I use on all the patients that come to see me in Lifestyle Medicine Clinic. And it just asks about, in the last 2 weeks, how often you've been bothered by the following problems. And again, the first two are related to anxiety, and the bottom two are related to depression. And so, from a clinical perspective, if you're a healthcare provider and you're using this, positive responses to any of these would then prompt further questioning and evaluation for an actual anxiety or depression syndrome. But if a patient is doing this or taking one of these stress screeners online, this just should prompt you that, hey, I do need to talk to someone. I can either reach out to my primary care provider or a psychologist or counselor, or another mental health provider like a psychiatric mental health nurse practitioner or a psychiatrist. But it does point to the need to look a little bit deeper to see if we need medication management or more structured cognitive behavioral therapy. Interrupting that cycle, right? There are kind of 4 things that I look at to break the cycle of not so great health behavior choices related to stress, right? One is to choose more plant foods. I know you've already had a whole talk on nutrition, so I won't spend a super amount of time there, but we want to increase real food, okay? So things that are not full of preservatives and additives and fat and cholesterol, and increase things like fiber and antioxidants. And those are going to be in your plant foods, your fruits, your veggies, your whole grains, and your plant-based proteins like beans and nuts and seeds, legumes, and those types of things. And so choosing more doesn't mean choosing only. So it doesn't mean you have to be vegan or vegetarian, but just choosing more plant foods. We like to focus on 3/4 of the plate being plant-based foods. Go outside and get moving, right? That's one of the areas from a variety of different things. Of course, being physically active helps with anxiety, but also getting outside and that exposure to sunlight helps to reset and regulate our circadian rhythm, our internal clock that will help us sleep better, right? Focusing on that 7 to 9 hours of sleep, and then learning and practicing stress management techniques. And it is not my job to tell anyone which one of those things they should pick to focus on first, right? It's whatever an individual feels like they are most confident at being able to work on. Okay? So goal setting, how do we set a really good goal? We want to make sure that those goals are SMART, okay? And so my healthcare providers that are out there, in particular my nurses, may recognize this SMART mnemonic as being from care plans, because that's how we were taught to generate goals for patients in a care planning standpoint. But it stands for specific, measurable, attainable, relevant, and time bound. And so those are all really, really important parts of setting a goal that you will likely do. So instead of saying, I'm going to sleep better, right? We start out with, I'm going to get 7 hours of sleep 5 nights of the week, right? That's much more specific and measurable and time oriented there. And I have an example at the end. Equally as important as the goal is to write the action plan that then goes along with it, right? Where you plan the steps. Nobody just magically gets the correct amount of sleep or gets a reduction in stress levels without putting in the steps to the work, so to speak, to get to the goal that you want. And don't ever forget the backup plan. I see a lot of folks that write really good goals for themselves and really good action plans, but they forget the backup plan for when life throws you a curveball. And after you do it, after you kind of write your plan, check your confidence. Do you feel like this is something you're going to be able to do? Stress management techniques, right? So these are my 3 favorite stress management techniques that I use with people in clinic to work on decreasing stress and developing different coping strategies. So the first one is abdominal deep breathing, and I put a link into the Cleveland Clinic's description of abdominal deep breathing. It's what I print out and give to my patients. But it works it's a relaxation technique that helps engage your diaphragm in breathing. So if I just asked you right now to take a deep breath, right? If you took a deep breath, you would more than likely be using the muscles in between your ribs to expand your chest cavity and take a deep breath. That is not a breath for relaxation, right? If I asked you to run down the hallway, when you got there, you would be using those same muscles to expand your chest cavity. So a deep breath like that is actually an energizing breath, not a relaxing breath. We want to focus on breathing from the belly, and that can be very hard to do. It's why it takes practice. So I usually recommend that people put one hand on their chest and one hand on their belly, and take a breath and see which hand rises more. Is it the chest hand or the belly hand? If it's the belly hand, yay. If it's the chest hand, then we're not breathing using our diaphragm. And so we really want to focus in and focus on making that belly hand rise. And I usually recommend people practice that for about 5 to 10 minutes a day, a couple of times a day, so that when you're in a stressful event, you can immediately go into your abdominal deep breathing. Okay? It's also helpful for falling asleep at night. Progressive muscle relaxation is another technique that involves the intentional focus and clenching of different muscle groups and then relaxing them. When your muscles are in a state of relaxation, it's much harder for your mind to be in a state of anxiety or stress. So this is another great technique for working on stress management, as well as sleep onset and sleep induction. And so I did put the instructions here for that one as well. And then 3 good things. 3 good things is focusing on the positive. And so this takes about 10 minutes a day. Usually at the end of the day is when I recommend this, and it asks people to think about 3 good things that happened to you today and write them down. Be as specific as you can, kind of explaining the event and how that made you feel. And I usually ask people to take it one step further and write one thing that they can do the next day to be somebody's good thing, right? So on Saturday mornings, my youngest child makes my cup of coffee for me. And that is a good thing that I write about every Saturday, because it makes me feel loved and appreciated. And so that's my good thing. But then I think about what would make him feel loved and appreciated. So maybe it's going outside and playing even when it's hot, if that's what he wants to do, or putting a puzzle together with him. Maybe that's what makes him feel loved and appreciated. So it really just reshapes and reframes the way you're looking at the world and takes that negativity out of things, because goodness, there's enough negativity out there that it's not hard to think of 3 bad things. So we want to reshape the way we think and focus on the good. So if we put that all together, the goal would be, starting today, I will decrease my daily stress to improve my overall health. The action plan would be, each evening before bed, I'll spend 10 minutes recording and reflecting on my 3 good things. I'll spend 5 minutes after breakfast, lunch, and dinner each day practicing my deep breathing exercises. And my backup plan is, if it gets all the way to the end of the day and I'm like, whoops, I didn't do my deep breathing exercises, then I will practice the progressive muscle relaxation at bedtime. So it's really just setting yourself up for success in working on your stress intentionally every day. Not with perfection, but with intention. So there are lots of different ways that you can interact with me and get in touch with me if you have more questions. This is my UMC email. It's the phone number to our lifestyle medicine clinic. You do not need a referral to schedule an appointment for lifestyle medicine. You can also interact with my social medias. I post lots of tips related to health and wellness, a lot of stuff related to nutrition over on Facebook and Instagram, some cooking videos up on YouTube, and then recipes are housed over on my website. And then you can always tune in to Mississippi Public Broadcasting on Mondays at 11 for Southern Remedy Healthy and Fit. And if you have a health-related question or an idea for a show for us, you can email it to fit@mpbonline.org. And that's just all I have today. I'm going to turn it back over to you.
And thank you so much, Dr. Bidwell. It was very timely, and we appreciate the information that you have shared. We also want to thank those of you who took the opportunity to join us today. Remember, the webinars are all housed on our YouTube page, so you can go back and listen to this one, because I know you couldn't click on links and everything while she was talking, as well as avail yourself to the previous webinars in our series. We will have our final webinar on the first Friday in August. So I'm going to allow all of you to get started with your holiday weekend, and please be safe and enjoy. Thank you, everyone. Have a good day.
Thanks, y'all.
Bye-bye.